Fantastic. Good morning, everyone. My name is Dominika Lipska-Rosecka. I cover for Sophie today, Sophie Eyre, who work alongside Gloucestershire Care Hub, and obviously Carers Hub, and Kathy Newman in Gloucestershire Health and Care Trust, kind of, around the carers work and what we do with kind of, around the co-production and involvement as well. So I'm a service development manager, leading on inclusion and involvement agenda. So yeah, very great to be today and present together with Fluffy to as a carer link. Oh yeah, there you go. So just a quick, can you see me still? Or can you see my presentation? Can you just tell me if you can see my presentation still?
Yeah, it's all there.
Yeah. Okay, fantastic. So, Expert by Leaf Experience Program and information for the carers. So I'm going to start off, who we are, and hopefully quite a lot already about the Gloucestershire Health and Care Foundation Trust. So we do provide NHS mental health, physical health and learning disability services to people all ages across Gloucestershire. We do this in our hospitals, in community buildings and primary in people's own homes. And I think I've got some statistics as well later on. Expert by Leaf Experience, so who they are, and we do have a program in Gloucestershire Health and Care NHS Foundation Trust, run for people who have personal knowledge of our services. So they have got expertise and experience of our services, but also we do have Expert by Leaf Experience carers who are obviously caring for someone who has that experience and expertise. Lots of ways the Expert by Leaf Experience get involved in our trust. So they taking part in a staff recruitment, focus group, project work, planning, design and delivery of the services. They are evaluating services and quality assurance with us, taking part in a staff training and co-design again, or delivering staff training, peer training, live better, to feel better, and recovery college. And engaging with the public at the events. So there is a range of the different activities Expert by Leaf Experience can take part. We've got around 190 people currently registered on our database, on our program. And obviously that's kind of, it's a diverse experience of physical, mental health and learning disability services. Again, different demographic, about 20% we've got currently carers, and we aiming for more, and we kind of actively promoting and recruiting as well underrepresented communities, carers to join our program to work alongside us, obviously, to improve the services. So yeah, so we've got this open recruitment all year round, and everyone is welcome to join the program. It's a simple application form, an agreement form to fill in. So as you know, just to kind of catch up where we are in terms of involvement and the carers work in a trust. So since the beginning of April this year, the carers Expert by Leaf Experience has been involved in 15 step challenges and Fritchie Centre and Pullman Place. We've got ongoing carers working group, which Kathy Newman is kind of leading for the trust around the quality projects. We've got as well, representation in our Working Together advisory group, which is advisory group at the board level to advise GHC, our Gloucestershire Health and Care Trust, Foundation Trust, to where we take an approach in terms of co-production and working together with people and communities we serve. The carers were speaking at our conference on veterans mental health. We had a person to come with the patient story within the trust board, and we continue to look into the carers patient story at the trust board. The carers were delivering courses at Recovery College and Live Better to Feel Better programs. They were active in CQC action planning, mental health survey outcomes as well. So there is this co-production group happening there, and obviously very active in recruitment panels for those job listed there. So very very diverse, as you can see, involvement where the carers, expert by lived experience, are involved in our trust. So now I'm moving on to the information for the carers, and which possibly you are the most important section, and you want to know more for that reason. So in terms of that information for the carers, so this started back in 2020, is that really, Lorna? You know, and I remember our first conversation having to think how during the COVID, how we will, during a pandemic, how we will kind of co-produce this vital resource. So during 2020, the Carers Hub reported significant numbers of new carers contacting them for information and advice. And definitely that was kind of a race in terms of mental health services in our trust as well. And then a mental health reflection group was established. So Gloucestershire Carers Hub staff and clinicians and other colleagues from across GHC, and obviously carers in the centre of this. This is how this started. So carers quickly told us that, you know, they want the information about the mental health services, and they would like to co-produce a resource for the carers that was useful and accessible. So 2 resources as a result were drafted, and general information booklet for the carers and a mental health supplement. So information from existing booklets, which we used to have pre-merger around mental health services, was used and added to. So carers were part of kind of putting this together, but also asked for the feedback on the drafts, and as a result, some amendments were made. And they were approved, both of those resources were approved by our internal improving care group back in April. And good news is they are now available and are printed as a booklet and also in PDF as well. So this is how they look like. If you haven't seen them yet already, or if you want a copy of it, please, you know, put in a chat as well. We can arrange that, but obviously through Gloucestershire Health and Care Trust, I think that's gonna be, it's already disseminated in some places, and Kathy possibly gonna tell us a little bit of more about the plans of disseminate those vital resources across the sites. So again, you know, there's a range of information using for people using our services, physical, mental health and learning disability. So that's a content. We focus on the issues which carers said they want to know about more. So confidentiality and information sharing was one of the vital one. We have included carers' own experience of caring and their thoughts on what helps them. So very personal statements there, very local as well from Gloucestershire, obviously, carers using the services. We have included guidance on what you can do if the person you care for becomes unwell. And that was part of the stuff which carers wanted to have included there. I think important message to take away is that we do have in Gloucestershire Health and Care Trust, this resource is now available. It's obviously, like I said, it's going to be disseminated in all of the sites. It's all as well available on our website, and making sure that our staff and colleagues as well are well equipped and do know about this resource. And this is a part of today as well in terms of, you know, spreading this message and making sure that the carers do know about this resource, co-produce, possibly some of you being today, you know, being part of that as well, co-design. And, you know, there is a lot of signposting information as well, sources of support and links to other information. So it's not only kind kind of, cover our GEATS Gloucestershire Health and Care Trust services and support, but also some national level and regional level support available. So that's really important. So I think, I'm going to just pass over to Kathy, because, obviously Kathy knows the plan about what's next with the carers information booklet.
So the booklet at the moment, hello everybody, sorry about my delay in trying to get on. I had to completely reinstall Zoom. So the carers booklet has been electronically available for a little while. If anybody does want copies, please do let me know, and I'm more than happy to share them out with you. We do have the physical paper versions now in plenty of supply. I'm trying to get them out as fast as I can to teams, site services, etc. It's a bit of a mammoth task. So I'm boxing them up as I can. We have the carer specific one with a mental health supplement that will sit in the back of the more generalized version. So the mental health supplement doesn't have to go to all teams and sites, but I am actually sending them. So I think that's quite informative to do so. So if anybody's got any particular desire for me to send them an envelope full or a box full, then more than happy to do so. Just let me know, ping me an email or contact me, and I can get that sorted.
Mm-hmm. If there is any questions related to the information booklet, like Kathy said, we're going to be sending this in PDF version. Is that right to share?
Yeah, electronically and paper copies. Yeah. Lorna, have you got a copy of the electronic version that we can actually add?
I can share that with anybody that's on the meeting today. So yeah,
we can add into the minute
and then
the chat or something.
Yeah, if they need your email address, I can also share that if anybody needs that. Again, if you want to just put anything in the chat, that's absolutely fine, everyone, and then I can pick that up, and then I can send the obviously presentation out to you, and then obviously then we can send you out the link, the PDF one as well. You're going to be at the event, aren't you, on Thursday, Kathy?
Yes.
Kathy will be bringing the booklets there, Tony. So if you are available and you are coming, obviously you can pick up one of the booklets there. But if not, we can obviously get them posted out to you. So that's not a problem. So yeah, if anybody needs obviously a paper version copy, please obviously let us know. We can do that as well. But again, Kathy will be there on Thursday, obviously for Carers' Rights Day. Okay.